Okay, friends, today we are seeing how to put the below knee plaster slab application. You can see I have put the stockinette inside first layer of the skin. Then over that the cotton roll has been layered in circular fashion. Just what I am doing is opening the dorsum part of the toes so that all the toes are clear and each toe should be visible for the patient and for us also. So we can ask them to move the toes while keeping the leg elevated for the reduction of the edema, initial swelling. And now I am taking the 6-inch plaster for the lower limb. Usually the 4-inch plaster is for the upper limb and the 6-inch for the lower limb. So this is gypsum plaster of Paris. So we have to take multiple rolls, layers, and you have to make roughly 14 to 16 layers. For the upper limb, it is 10 to 12 layers, but for the lower limb, it is 14 to 16 layers. You can see that I have kept the patient's leg on the one bolster, so I can get the clearance. And I'm making the plaster on the Macintosh so that leg doesn't get soaked. Now, once you roll over this layer, you have to count, and if it is less, then you have to add another plaster. Now, after taking this all the layers, I will dip in the water. Usually, I advise to keep little bit hot water in the winter season, especially, so that plaster gets set early. Not too much hot. It should be kind of warm water. You have to squeeze the extra water. The dipping time is usually 3 to 5 seconds. And once it is done, you just apply on the back side. So this is slab. This is for the initial fractures of the metatarsal or any small foot fracture. So this will give time for the swelling to come up, and initial time circular full plaster is not required. My assistant is holding the plaster of Paris and I am just wrapping the bandage so that you can start from below or upside. Not too much tight to constrict the blood supply of the fracture, but it should be firm enough to hold the plaster in the secure position. So from the below upwards, you can come like in circular fashion. And meanwhile, the assistant maintain the position of the plaster. And once you finish, you have to just remove the bolster and keep the ankle in the 90-degree position for the proper setting and mold it. Thank you.